Hey folks, Dr. Joe Esposito here. Glad to be with us today. What we're talking about today is bone health. Osteoporosis, osteopenia, tensile strength, risk factors, the medications for osteoporosis work, what the side effects might be. So a lot to cover when it comes to bone health, but you're thinking to yourself, but Dr. Joe, I'm a 35-year-old man. I don't have to worry about this. Obviously, this isn't a show that's going to interest me. Wrong answer. We're going to cover a lot of these things because what you're doing now is going to have an impact on your bone health later on all your health, not just bone health. But you have to understand what you're doing now and hopefully make some changes, because if you don't make the changes, you will most likely have these problems. Very few people get out of this unscathed, so you always pay for the sins of your past. We all do. And so you're going to have to pay for the sins of your past as well, and that's what we're going to talk about today. And you're going to be surprised. Going to give you some information you think is right that's wrong, which is kind of interesting too. So bone mineral density, that's what we're talking about here. Osteopenia is thinning of the bones, the beginning of thinning of the bones. Osteoporosis is the actual full-blown thinning of the bone. So osteopenia can be diagnosed with x-rays, plain methods you could use. But when you have osteoporosis, you want to use something called dual energy x-ray absorptiometry, and that's called DEXA, D-E-X-A. Now, with osteoporosis, in order to show up on the x-ray, it has to be about 33% of the bone loss gone. So we can take an x-ray of somebody, and if it's not 33%, it may not be showing up, even though they do have bone thinning. So I've had patients come in already and say, well, Dr. Joe, I've had x-rays done, it looks good. And then we go out and do something a little more advanced in testing, and that's when the problem shows up. So you got to understand that just because it's not on the x-ray doesn't mean it's not a problem. Same thing with osteoarthritis. Now, as a chiropractor and a pain management expert and board certified in orthopedics and pain management and nutrition, and so I see a lot of x-rays and I see a lot of patients. I see their MRIs, their CAT scans, their x-rays, their blood work. And when I look at the x-rays, if I see arthritis on an x-ray, degeneration of the discs, in the spine, it has to be there at least 10 years for it to even show up. So when I see arthritis on an x-ray, I can say this has been here at least 10 years. Somebody else might come in, have no arthritis, but they're having pain and they got in a car accident or they had a sports injury. And I'll say this will develop arthritis if we don't fix it. And again, it's the only promise I can make my patients is if you have a problem with structure, it's going to get worse unless you do something about it. I can't promise we can fix you. I can't promise we can do miracles. Usually we do, but I can't promise that. But what'll happen is if the bones are out of place, they will wear out. But it takes years to show up. Same thing with osteoporosis. And they use something called a standard deviation. And what they do is they take a healthy 30-year-old woman, same sex and race as you, and then they base it on that. And then you have a standard deviation. If you deviate too far from the standard, that's when you start to have some problems. So some of the factors that's going to affect your bone health. Number one, gender. Women are higher risk than men. They have less bone mass than men, too. Men have thicker bones. And women often experience bone loss after menopause. So they'll see bone mass loss after menopause because they stop producing so much estrogen, and estrogen helps build bone mass. Race, Asians and Caucasian women, especially those with small bones, at higher risk. Family history, patients with a family history of low bone mass have a 50 to 85% increase of developing osteoporosis. Age, men and women about 0.5% bone loss for every year after the age of 50. So if you're over 50, statistically, you're losing bone mass. Now, that doesn't have to happen. As with most health issues, average and normal are two different things. Average is what most people have. Normal is what it should be. So, for example, when I donate blood, they look at my blood and they say, oh my gosh, your blood is so bright red. And when I put the needle in me, the blood flows out very quickly. And they say, well, this is crazy. I've never seen blood flow this quickly or this color. The reason is that's normal, not average. Average is they take 100 people who eat a standard American diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. And then they say, okay, 100 people, divide that, take the samples, divide it by 100, that's average. I don't want to be average. I want to be normal. And that's a big difference there. Poor diet, of course, lack of nutrients. We always think about calcium when it comes to osteoporosis, but calcium is only part of the equation and actually not that big a part. Now, volume-wise, it's a big part. But if I'm going to make a cake, I have to have all the ingredients, and then I'm going to add some baking powder to it. I think it's powder, right? Or soda, anyway. You add a little tiny bit of it. You add maybe a quarter of a teaspoon of vanilla, and that changes everything. That's what happens with the bone. Yeah, it's mostly calcium, but you need all the ingredients to make it work. If you have things like hyperthyroidism, hyperparathyroidism, Cushing syndrome, this can contribute to bone loss as well. Even medications like prednisone can cause bone loss. So I'm not against medication, please understand that. However, if there's a way to avoid medication, that's what I want to consider. If we can avoid taking meds, that's my goal. And people tell me all the time, every day I'm getting an email or a message, Dr. Joe, what do I need to do to get off my blood pressure medication? And I say, don't come off your medication. Let's get you well enough so that you don't need your medication. That's the difference. See a little semantics there? Let's get you well enough so you don't need the medication. And that's where we incorporate chiropractic, we incorporate nutrition, we incorporate supplementation, and then hopefully you're well enough that you don't have to take those medications. Same thing with osteoporosis, because when I get to it, you're going to be blown away with the studies we have on the medications that we give for osteoporosis and why it may not be the best thing for you. According to the International Osteoporosis Foundation, osteoporosis affects about 1 in 10 women age 60, 2 in 10 women age 70, and 4 in 10 women age 80, and 2/3 of women over age 90. So it's pretty out there. A lot of people have it. Osteoporosis comes the risk of bone fractures due to falls. Hip fractures can be notorious for raising older individuals' risk of death. Many old people fall. And when they fall, they break their hip, and that's the beginning of the end of their lives. So we do a whole protocol in our office on fall prevention. And most of it, we kind of just incorporate it without chiropractic. So if somebody has a bone out of place, that can cause pain, which can cause you to be unstable. You can also affect the cerebellum, which is the back part of your brain. And that part controls balance. And then also your inner ear. There's things called canals, semicircular canals in the ear, and the semicircular canals can control balance as well. So weak muscles, weak bones, pain, osteoarthritis, a lot of things can cause people to fall. But if you fall and break a hip and you have osteoporosis, that's not a good thing. 34 million Americans also have low bone density called osteopenia. So again, osteopenia is the early stages of osteoporosis, and that raises your risk of fractures and may progress into osteoporosis. So in the United States, 54% of postmenopausal women are osteopenic, have osteopenia. So more than half of the women who are postmenopausal have this problem. An additional 30% are already in full-blown osteoporosis. By age 80, it predictably shifts, and it just keeps getting worse and worse. 70% of women can be osteoporotic, depending on what study you read. So it's obviously a big issue. It's expensive. I'm going to get to that number in just a second. Bone fractures significantly compromise the quality of your health and is a major stress on the healthcare system. So here's the thing. Get on my soapbox for a second. I hear people all the time talking about healthcare. We have to have a better healthcare system. We have to have the Affordable Health Care Act. Well, did that work? Did it not work? Well, with $6,000 deductibles and $100 copays, not a big fan. I don't think any doctor. I've never met a doctor who's a fan of that, by the way. And I know hundreds, probably thousands of doctors. So we keep talking about healthcare costs. Nobody, except us and maybe a few others, are talking about what we can do to lower those costs. What if we lowered the risk of osteoporosis? Healthcare, 2005, this study was done in. Direct costs associated with fragility fractures, which is as you get older and the bones break, $19 billion. By 2025, $25 billion a year for one condition, osteoporosis, most of which is preventable. So why aren't we talking about these mass commercials and these mass movements to get people well and prevent diseases, as opposed to spending upwards now $25 billion on one condition, osteoporosis and fractures? It's crazy. That's why this show is so popular. People listen to it and they take my advice. Other fragility fractures, again, weak bones, significantly decrease the quality of life. Hip fractures alone are associated with one-year mortality rate greater than 20%. So 20% of people that have it can die. It's crazy, and it's so easy to work with. And here's the thing. When you do the right things to keep the bone strong, you're working on other comorbidities. Now, you heard me talk about comorbidities on the show we did on COVID. Comorbidities are other diseases that are going on. So if I have COVID and I have high blood pressure, risk of dying goes up. If I have diabetes, risk of dying goes up. Obesity, risk of dying goes up. So comorbidities are other conditions that you have that are going to complicate the condition that we're dealing with, in this case, osteoporosis. So you're really skyrocketing these issues. So if you're taking care of yourself, you're eating right, you're doing the right supplements, you're doing the right care for your body, you're going to reduce mostly all, the comorbidities. And we're going to save so much money. This is the solution to healthcare, folks, is treating the cause, not just treating the symptoms. I am not against treating the symptoms. We have a medical department in our offices, and our medical doctors, they can do injections into the spine. There are times when we can give you the best chiropractic care in the world, and you're just not holding your adjustment. You're just not progressing like we want. We can go in there and do some medical intervention. Maybe we can do a nerve block. Maybe we can do a facet block. Maybe we can do some medications. We can do PRP, which is amazing. I'll talk about that in a second. We can do these things, and then the adjustments work better. So in our offices, we have the best, what I feel, of all worlds when it comes to entry-level healthcare. We want to do nutrition, we want to do digestion, we want to get pain management, we want to do spasm reduction. We can do all of that in one place. And that's what makes it so easy. You don't have to run from one doctor to another doctor. And how many people have ever done this? You go to one doctor and they go, all right, I'm going to send you out for this referral, that referral. And you start bouncing around and you're just running around from doctor to doctor, and you may not be getting all the results that you want. We try to do it all in one place. And we have other doctors we can refer to. We had a car accident come in the other day. We see a lot of car accidents. And there was looks like a closed brain injury, okay, head injury. And the skull whipped back and forth. It looks like the skull slammed against the brain slammed against the skull. An inflammatory reaction. They were dizzy. They weren't quite clear on what their thought process was. Their cognitive function was affected. Sent them out to a neurologist, a neurosurgeon, actually. We sent them out because we think this person needs surgery. So we work very closely with a team of doctors to try to get the best results we can from you. But in our office, we try to do as much as we can. And we talked about osteoarthritis earlier. We do a treatment in our office called PRP, platelet-rich plasma. And we take your blood, spin it down, and take out the growth factors, called the platelets, and we can re-inject them back into your body. And it's a super high concentration of the natural healing factors that are in your body. There are things like stem cells and other things where you use other people's cells. Might be helpful sometimes. I'd rather start with your own cells. I find we get great results with it, way less expensive too. And so I'd like to try that first. And in most cases, people are happy. So we have what we call escalation of care. We start out with chiropractic and nutrition. So with osteoporosis, a lot of that is nutrition. And we teach you, this is what you need to eat, what not to eat. And in most cases, we get great results. The same diet, the same protocol, I should say, that we talk about with osteoporosis works for hardening of the arteries and heart disease as well. So it's pretty much a standard protocol that helps so many other diseases. So we start you out there. If we need to, we can go to PRP. If we need to, we can go to pain management. We can escalate the treatment to do the best we can. And in car accident cases, that is usually by far the best form of treatment, escalation of care, because you want to start out with the basics and then go from there if you need to. And the insurance companies love it because you've proven, okay, we tried the least expensive treatment, we got great results, but we needed this or we needed that. Many times that's all we need. It's chiropractic care. So start considering the word escalation of care when it comes to your healthcare issues. Start out at one place. Where do you go? How many of you have been to the doctor? Well, you know what, Bob, you got high blood pressure. Take these medications. What am I going to do with them? I don't know. Take them forever. Any other treatment? Nope, that's it. Cut back on your salt. There's no escalation of care. And so if one thing doesn't work, you're kind of stuck. And that's why I'm a patient in my offices too, so it's kind of nice. Back to osteoporosis. Let's talk about the best ways to deal with it. There are some things you can't fix. You can't fix age, sex, ethnicity, family history, menopause, but there are modifiable risk factors. These are the things that you have control over. Nutrition, vitamin D deficiency, balance and lifestyle choices, smoking, lack of exercise, alcohol consumption. So medical conditions that raise your risk of osteopenia and osteoporosis are some things maybe you can't control. Things like hyperparathyroidism, anorexia, malabsorption syndrome, hyperthyroidism, chronic renal failure, hypogonadism, which is when the genitals, the reproductive organs are not, they form abnormally small. Amenorrhea, which is not having a menstrual cycle, early onset menopause, calcium and D deficiencies. Now, I said you can't control them, but we've done shows on just about all of them. If you go to our website, drjoe.com, we've done shows on digestive issues, thyroid problems, eating disorders, kidney issues. In fact, no, kidneys coming up. We got a show on kidneys coming up, actually. And one of the big things with kidney issues is too much protein. Now, I've been vegan 34 years now. I'm not asking you to be vegan. Don't get nervous. But every day, how do you get your protein, Dr. Joe? And Garrett and I laugh. We're just going to print up cards and just hand them out, like here. You don't need more protein, you need less protein. But one of the things we covered in a show we did on protein was that most people are getting way too much protein. And if you're eating too much protein, that's putting a major stress on your kidneys. And now the kidney problems can lead to osteoporosis. Eating heavy protein means you're eating a lot of acid. Now, the acid foods are the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. If you're eating a lot of acid foods, your body has to neutralize those acids. The body uses calcium as its primary neutralizing agent. So your body's going to give up calcium out of the bones, out of the blood, to neutralize the acids in your diet so the blood doesn't get too acidic, because that'll kill you. And so you're sucking calcium out of the bones if you're eating a high-acid diet, which are the 7 deadly sins. Those acids then have to be filtered out of the body through the kidneys, and now we can have kidney problems. So really simple fixes to this, especially osteoporosis. In most cases, there's a lot of simple fixes that you have control over. Again, you can't fix certain things, like I said, age, ethnicity. You can fix if you're obese. You can fix your diet. You can fix your vitamin D consumption. You can fix your acidity intake. All these things are manageable, and that's what we're talking about today. Drugs can trigger or worsen bone loss. If you're taking steroids, that can be a problem. Sometimes there's even a chemical called triclosan. Now, before COVID hit, so actually a couple of years ago, we used to put triclosan in hand sanitizers. Now, I talked about this many times on shows in the past. The hand sanitizers, anything you put on your hand gets absorbed. Your skin is a sponge. So anything you put on your skin is going to get absorbed into your blood system. So triclosan is a hormone disruptor. It's an endocrine disruptor. And people like me jumped up and down, yelled and screamed and said, take the triclosan out of the hand sanitizers, especially with kids, because it's really have an impact on the kids. So the good news was we won. Triclosan was banned from hand sanitizers. The problem is, where else you might find triclosan? Toothpaste. How insane is that? We're putting triclosan, a known endocrine disruptor, in toothpaste. And you put it in your mouth, where do you have a lot of blood vessels for quick absorption? Your mouth. Drives me nuts. But triclosan can also contribute to bone loss because it's an endocrine disruptor. Now, let's also discuss the primary treatment from conventional medicine, which is something called biphosphonate drugs. These are the drugs you see advertised all the time for osteoporosis. I won't say brand names. I don't advise people to take them or not take them. I'm not a medical doctor. I'm not telling you. I'm not your primary doctor. I don't want to tell you what to take or what not to take. What I'm telling you is, let's point out some of the dangers and let's give you some options. If you need the medication, take the medication. But I want you to escalate your health care. I want you to try everything you can first to build up to it. So these medications include high risk of thigh bone fractures, the very thing we're trying to avoid. We have thin bones. We're trying to not fracture them, but it increases your risk of thigh bone fractures. There's a warning about atypical femur fractures on the package, and it's been there since 2011. These medications also have been linked to osteonecrosis of the jaw. I saw 2 of these, I think, in my whole career. The jaw bones are actually just being eaten away. It's like it's death. Necrosis means death. So the jawbone actually dies. And I've seen it on x-ray, and it's horrible because it's really not a whole lot you can do about it once it gets to that point. Now, you can change your diet and increase your alkalinity and supplements and everything, but you don't want your jawbone dying. Let's stop there. It can cause inflammation in your eye, liver damage, atrial fibrillation, esophageal cancer, kidney toxicity, too much calcium in the blood. So most people don't address the underlying problem. They give them the medication, and that can make your bone thicker, but also make it mechanically weaker. And that's what we're talking about with these medications that we give people for osteoporosis. So this was done in 2017, was a study done which used a particle accelerator to generate exceptionally detailed images of internal structures of bone samples from 10 hip fracture patients on these BPs, these medications. 14 samples, what they called naive fractures, bone fractures in patients who were not treated with the medication. And so they did a control study. And what they found, if you're taking these medications, 28% lower in strength than the untreated hip bones and 48% lower in strength than non-fractured control bones. So by taking the medication, your bones are now 28% weaker. Doesn't make any sense, but what happens is this, real simple terms. It takes the bone, and it's kind of like a marshmallow. If you roast a marshmallow, it makes the outside kind of hard and crispy, but the inside is weaker. So yeah, I can take an X-ray, or I can do a DEXA study, and we can say, yes, the bone is looking thicker. Look at this. This is great. The medication is working. But when you go inside the bone through a particle accelerator, we find the inside of the bone in 28% of the patient was actually weaker. Had no detectable mechanical benefit in the specimens analyzed. Instead, its use is associated with substantially reduced bone strength. That's this study out of 2017. So once again, if you have osteoporosis, has anyone ever said to you, let's measure your vitamin D levels, let's look at your diet, let's put you on an alkaline diet, let's make sure you're getting calcium, magnesium, boron, silica, you have to have everything mixed together. Has anyone ever been to a doctor and they said that? No, of course not. So, because the drug is not going to change the fact that you don't have all these nutrients in your body. If you have low vitamin D, taking medication is not going to raise your vitamin D unless it's a vitamin D supplement. So we're treating the symptoms, we're not treating the cause. Now, how about this? I'll negotiate with you. What if we do both? And then let's see what happens. Or let's not have it happen to begin with. So the results suggest that reduced bone strength in these medication group is due to accumulation of what we call microcracks. So the microcrack is these tiny little cracks in the bones. And then you get a bunch of them, and the bone can actually fracture. So bone is living tissue. It's constantly adding new bone and removal of old ones. It's called osteoblasts and osteoclasts. Bone, a building with B, osteoblasts, they build up bone. Osteoclasts break down the old bone and get rid of it. So you're always changing out your bone. So peak bone mass is a term used to describe when you have the most bone mass. It's usually between 25 and 30 years old. So we have to get the bones back to that level if we can. I'm going to have to go to a break. When we come back, I'm going to go through a list of supplements that I want to make sure you're getting in your diet, or nutrients you're getting in your diet, or supplements. So we're going to go over that pretty much in depth with you. If you have a health issue, if you have neck pain, back pain, shoulder pain, headaches, you've ever been in a car accident ever, if you'd like to make an appointment to come see us, I'd like for you to do that. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can go right on our website, drjoe.com, drjoe.com, and we will do an evaluation for you. Initially, the initial visit is usually $375. We've reduced that to $149 through this COVID mess. That's an exam, x-rays, consultation, first adjustment, the second visit going over the x-rays, and then setting up a time to do a nutrition evaluation as well. We do it at that time if we can. So all of that is $149 for future treatment. We do accept insurances for treatment beyond that. And again, if you've ever been in a car accident, ever, if the car was damaged, you were damaged. Now, if you need a medical evaluation, if you want an evaluation for pain management, for PRP, which is injecting your own growth factors back into the bone to stimulate bone growth and decrease inflammation. Works very well, and that's your own blood that we're putting back in a concentrated form. Hormone balancing, if you have hormone issues. If you'd like to set up a time with our medical doctor, you can do that on the website as well, drjoe.com. And so the website has over 1,500 hours of podcasts on it, so you can search what you're looking for. If you don't find what you're looking for, send us a question. I'm more than happy to answer your questions. drjoe.com, it's easy. Just send us a question. It pops up on the website. And you see where our offices are. All the supplements we're going to talk about are on the website as well. You can order the supplements right there at drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show. We'll be right back. Hey, folks, Dr. Joe Esposito here. Glad you can be with us. We're talking today about bone health, because so many of you have problems. And in the first part of the show, we talked about by 2025, hip fractures can cost up to, what was my number again? $25 billion in just one issue, hip fractures from osteoporosis. So that's a big concern, because no one's talking about what to do about it. Keep eating your bad food, your alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. And when you get osteoporosis, we'll put you on medications, but we also discussed that the medications, the standard ones we use, are showing now that the bones are not getting stronger. They're getting thicker, but their strength is actually weaker because they're weaker on the inside, and you can get something called micro cracks, which are little tiny cracks in the bones if you take the medication. So we got a problem. What we're doing isn't working. Cost keeps going up, and yet we keep doing the same thing. What was that? Insanity, right? Doing the same thing over and over again, expecting a different result. So it's not working. I've never, ever in my life seen anyone get rid of osteoporosis by taking medications and or taking calcium. Now, the bone density might get thicker, but again, if we look inside the bone, that's what we're showing here, that it doesn't usually work. Now, I shouldn't say never. I guess it might happen somewhere. But Garrett had a good question at the break. And his question, what about calcium? I'm going to cover that in just a second because that's what everybody's wanting to know about. What about calcium? And I got some good, bad, and ugly on calcium. Again, so bone is living tissue. So let's talk about some nutrients that you need to build this living tissue. If I'm going to build a house, I'm going to need bricks, and I'm going to need mortar, and I'm going to need electrical wires, and I'm going to need toilet seats, and there's things you need to build a house. If I'm going to build a house, and I don't have all the materials that are approved materials, I can't get my building permit and my certificate of occupancy. So even though I built the house, it's not solid enough to be moved into. Same thing with your body. If you're not giving the body the materials it needs to build everything that it needs to be healthy and safe, it can't work. So for example, you can't build bone without vitamin D. Now vitamin D as a regulatory in the absorption of calcium and phosphorus has a role there. And vitamin D levels are low. If you have that, parathyroid hormone increases, and that triggers osteoclasts. Again, osteoblasts build up bone, osteoclasts break down bone. So not enough vitamin D, your parathyroid hormone increases, osteoclasts release calcium into the blood from the bones. They take calcium out of the bones and put it in the blood, and this process over time weakens the bones. So you need vitamin D to regulate your parathyroid hormone to make sure you don't release the osteoclasts and suck calcium out of the bones. Deficiency can create secondary hyperparathyroidism, leading to a loss of collagen matrix, which increases the risk of osteoporosis and fractures, which is the building structure the bone is built on. So poor bone remodeling due to higher osteoclasts versus osteoblast activity occur with low levels of vitamin D. You have more cells breaking it down than you have building it up. I can't stress enough the importance of vitamin D. We talk about it. We did our show on COVID, colds, and flu. We talk about it with immune system. We talk about it with bone health. Vitamin D does so many different things. It's the least expensive insurance policy you'll ever buy. So why you're not taking vitamin D, especially in the winter months, blows my mind. The only way to know how much vitamin D you truly need is to get a vitamin D blood test, and we can do that at our offices. And we do it as part of what we call a micronutrient test. So we test B vitamins and D vitamins and your antioxidant abilities, and we test a lot of different things on this test. Really good test. It's a good snapshot of your health, of your overall health. So you want to make sure that you get your vitamin D levels tested, and if the vitamin D levels are low, you want to make sure that you take your vitamin D. I suggest taking vitamin D supplements from fall to spring. Now, if you're out in the sun in spring and summer and early fall, that's fine. If you get about 10 or 15 minutes a day, a couple of days a week, probably 3, 4, 5 days a week, you're in good shape. If you start losing that, if your vitamin D gets too low, take a supplement. I take 5 drops of Dr. Joe's vitamin D3. I recommend D3 and not D2. D2 is usually the medicine is a synthetic version. It has to be converted into D3. So I'd rather you do the vitamin D3, not the vitamin D2. And I take 5 drops a day. We did our colds, flu, and COVID session just last week maybe. And we talked about the importance of keeping those vitamin D levels high. And if you feel symptoms coming on, if I feel symptoms coming on, I'll take 50,000 international units for 2 or 3 days, maybe 3 days, and then cut back to 5,000 again. When I say 1,000 international units, it's 1 drop. So don't think I'm taking 50,000 pills or something like that. So 1 drop is 1,000 units. So I strongly advise that you keep those vitamin D levels where they need to be. Part of it, for many, many reasons, part of it today, of course, being bone health. Vitamin K1 is found in plants and green leafy vegetables. It plays a role in blood clotting, and it's important for bone health. There's a difference between vitamin K1 and vitamin K2 because our Super Greens, and especially the Essential Source, has a lot of vitamin K1 in it. So people will, and I tell people, listen, if you're on blood thinners, you got to be careful to take Essential Source. If you're taking Essential Source, notify your doctor and just say, hey, listen, this is going to be my new diet. I'm going to a plant-based diet or close to a plant-based diet. You don't have to do everything, don't worry. And I'm going to start taking super greens and essential source every day. And in every 4 weeks or 8 weeks, whatever it is, I want you to monitor my blood levels. And I want you to see if I need to change my medication or not. I don't think I've ever had anyone have to change their medication because they were taking vitamin K. Now, in theory, vitamin K causes blood clotting. You're on blood thinners. You shouldn't take the blood clotters. Make sense? But I've never had anyone ever have to change their diet now, or their medication. But you want to tell your doctor you're taking it, and then you got to take it every day. This becomes your new norm, okay? That's K1. K2, vitamin K2, is synthesized by intestinal bacteria, so you make it yourself, and it works with calcium, magnesium, and vitamin D to build healthy bones. So K2 is different than K1, slightly different. It does slightly different things. So K2 directs calcium into your bones, and it prevents it from being deposited in your soft tissue, your organs, your joint spaces. Because as a pain management expert, patients come to me all the time with pain, and we look at their joints, and sure enough, we can see that the joints are starting to get a little built up with calcium. K2 can help drive it out of the joints. So another reason why you should be taking Dr. Joe's vitamin D3 with K2. It's not just about bone health. It's about keeping the calcium out of where it doesn't belong and putting it where it does belong, which is in the bones. Evidence of 7 Japanese trials assessing the ability of K2 to prevent fractures, they found this. When we assessed absolute differences in fracture rates, a significantly reduced rate was found in all fracture sites, with hip fractures reduced by 6%, vertebral fractures by 13%, and other fractures by 9%. So yes, there is a significant improvement with just making sure you have enough K2. And that's why when I made the vitamin D3, I added K2 to it, because they work synergistically, and most people don't get enough K2. Because K2 you usually can get from fermented things like fermented vegetables or natto, which is fermented soy. Most people don't do that. So I said, let me just put it in a supplement form. Let's talk about calcium. Finally, we get to calcium. Calcium works with K2, magnesium, and D3. You need all of that. And vitamin D aids in the calcium absorption, while K2 makes sure the calcium ends up in the right place. So D3 gets it into the body, and K2 says, go over here, go over there. Your bones is where it belongs. It doesn't belong in your arteries. If you don't have enough K2, it's more likely to build up in your arteries. So taking high-dose calcium supplements while being vitamin K deficient can actually lead to hardening of the arteries. This is why with calcium, I'd rather you get your calcium from your food and from super high-quality supplements, things like Dr. Joe's Essential Source. So that's where I don't take any calcium supplements, but I eat a good plant-based diet. I get lots of calcium in my diet. I take Essential Source, of course, at least once a day, sometimes twice a day, and my calcium levels are perfectly fine. So yours can be too, if you're doing the right thing. Significant calcium intake is important to prevent osteoporosis because if the body's stores of calcium are low, calcium will be leached out of the bones. But if you're eating a good diet, here's the thing. If you're eating a good diet, you're not eating a bad diet. And the bad diet has the acid foods in it, the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, which rob the body of calcium. If you're eating a good diet, you're not eating the bad food, so you actually need less calcium because you're not wasting it on neutralizing the acids in your diet. Did you follow that? So eating a good diet is really, really, really important. And as far as supplements go, Garrett said earlier, be careful about the supplements that they may add to nutrients. Fortified with calcium. Usually it's fortified with calcium carbonate. Calcium carbonate is not a good form of calcium. Calcium carbonate can prevent you from absorbing the better forms of calcium, like calcium citrate. So some people say, well, I take these little chewable antacid pills because they're high in calcium. And I've had doctors do this. Blows my mind. Take these antacid pills as your calcium supplement. That is insanity because, A, you need stomach acid to absorb calcium. If you're taking antacids, you're not producing as much acid, or you're reducing the acid levels in the stomach, so you can't absorb as much calcium. It's calcium carbonate, which can block you from absorbing the good forms of calcium, and there's chemicals and dyes in there, and it's going to alter your body's ability to digest food if you're taking a medication you don't need. So I can't imagine a more insane thing to tell people than to take these little calcium tablets. It drives me insane. If you're going to take calcium supplements, again, calcium citrate will be a good idea, but most times you don't need it. Because if you're taking calcium supplements and you don't have enough K2, you're going to absorb the calcium and it's going to deposit in places it doesn't belong. So taking calcium supplements is not something you want to just haphazardly throw into your body. It's not a good idea. I'd rather you increase the K2, magnesium, and D3, and then you utilize the calcium that you're getting from your food. With me so far? All right. So magnesium, really important. Low levels of blood magnesium correlate with bone density, low bone density levels. Several studies have supported the use of oral magnesium supplementation to increase bone density. Magnesium can impair your parathyroid hormone, and we talked about parathyroid hormone earlier, how it affects blood level, calcium levels. So magnesium is great. If you're eating a good diet, you're probably getting enough magnesium, fruits, vegetables, nuts, and seeds. You can take a magnesium supplement if you want to, if you need it. Here's the thing. If you take too much magnesium, you'll get diarrhea. That's what they make milk of magnesia out of. Oh, that's where that word comes from. So, yeah, you don't want to be doing that if you don't need it. Okay, so don't take the milk of magnesia. Don't take milk of magnesia if you don't need it, but don't take magnesium supplements either. We talked about that with vitamin C last week. You take it until you hit what's called a bowel tolerance. Bowel tolerance is how much my bowels can absorb before I start to get loose stools. And so with vitamin C, I said if you feel a cold coming on, you want to take maybe 1 or 2 grams of vitamin C an hour until you start to get loose stools. And if you it starts burning your stomach, you can get something called liposomal vitamin C, which is vitamin C encased in a little fatty layer. And that will prevent the stomach upset. But you take it until you get loose stools, and then that's your bowel tolerance, cut back to about 80% of what you took. So same thing with magnesium. But again, eating a good diet is going to be the key. Here's the mineral that so many people are missing. And I'm going to tell you why it's so important. Boron. You've probably never heard of it. High concentration of this trace mineral are found in bones and teeth enamel. According to Natural Medicine Journal, boron appears to be indispensable for healthy bone function, and it reduces the excretion of calcium. So 1 lets you absorb it, vitamin D. K2 tells it where to go. Boron prevents it from being flushed out of your system. It may also help in other ways. It's poorly understood in bone building, but we know it works. But here's the other thing with boron. A lot of people come to me, and as we get older, this is going to happen to you, unfortunately. Your testosterone levels are going to start to drop. And as the testosterone levels drop, we can do several things. Fenugreek is a supplement that you can take that'll help naturally increase your testosterone levels. But it's not the testosterone levels that I'm so worried about. It's something called free testosterone. Testosterone is bound up with other proteins. Free testosterone means it's broken free and it's usable by the body. So free testosterone happens when you have enough boron in your body to cleave it off the bound testosterone and make it free testosterone. And if you're deficient in boron, it can affect bone health, but it can also affect testosterone levels. Now, I'm working on a new supplement, actually, that's going to have fenugreek in it, tribulus, which is going to help stimulate adrenal function, and boron to help naturally increase testosterone levels. Now, in our office, our medical doctor can do a hormone panel on you. We can do blood draw and do a hormone panel on you, and then we can put together exactly what you need. Sometimes I'll even recommend bioidentical hormones short-term until you get those hormone levels back up normally again. So just so you know, a little insight of my supplement I'm working on in the future. I don't even know if I told Garrett this one yet. Working on it to try to get those testosterone levels up. So I'm working on that. But in the meantime, come see us. Let's see if you even need it or not. And if you do, we can always get you on bioidentical short-term and balance out those hormones. Because testosterone is important for muscle mass, but not just your biceps and your triceps. Your heart's a muscle. Your sex organs, your blood vessels, your colon. And many times as we get older, we don't build the muscle mass that we need to support the adjustments chiropractically. So sometimes we got to get those testosterone levels up to build the muscle mass up to hold the adjustment better. See how it all starts to work together? This is called functional medicine. Just about every day I get a call from somebody saying, do you guys do functional medicine? Functional medicine is a very broad term, but the answer is yes, because we work on the nervous system, the digestive system, the diet, supplements, hormones if we need to, pain management. So I think what we do is even beyond what most functional medicine doctors do, because we try to incorporate the best of all worlds, if we can say that. The chiropractic, the nutrition, the digestion, the supplements. So that's why we get patients literally from all over the world. I had an email just before I went on the air, somebody 2.5 hours away. Is it worth coming to see us? I said, I can consult you online. I mean, we can do online telemedicine if we need to, but the best is if we can go one-on-one, because with chiropractic, you really got to touch the patient. Unfortunately, there's no way to do it over the phone. We haven't figured that one out yet. Here's some surprising information about osteoporosis. You hear about resistance training, weight training, very important. There's evidence supporting the notion that high and moderate impact resistance training benefits bone health. Heavy weightlifting may be unsuitable for older people with osteoporosis. I mean, think about that. You got osteoporosis, you're not going to be, pumping the iron. Low impact resistant training, aerobic exercises, and walking have been shown to have little or no effect on bone loss. Whoa, dude, wait a minute. I've been told all my life that I've been told this too, but the new research is out. The problem is load-bearing exercises that is most simple to do not produce enough a significant osteogenic load, stress on the bones. Research suggests the load needed to trigger bone growth in the hip is 4.2 times your body weight. Conventional strength training comes nowhere near that. I mean, think about this for a minute. If you weigh 150 pounds, that would mean you'd have to deadlift more than 600 pounds. Not many 150-pound people can deadlift even half that. So staying active is important, but more important is the nutrition. And again, this weight-bearing exercise is the osteoblastic load that you're going to put, bones that are going to build stress that's going to build osteogenic load, is going to be an issue. So what we have to do then is we have to make sure the diet is going to be right. If the diet isn't right, you can be working out all day, it's not going to work. And that goes for all diseases. Exercise is great, but even weight loss. When it comes to weight loss, the body does about 85% diet and about 15% exercise. So people say, well, Dr. Joe, I hurt my back. I can't exercise. I can't lose weight. The answer is, nah, I'm not going to buy that, because you can lose weight. Now, as you get older, sometimes it's hard to lose weight. I know that. And so that's when we might need to boost you a little bit. Now, we are working with we're co-working with another company, and they have a machine actually that we can put your body on this machine, and it causes the muscles to contract for you. I am blown away with the results. I've had 4 sessions so far, and I'm amazed at my abs. I mean, it's like I haven't had abs since I was in high school like this. It's really kind of cool. It's not comfortable, I'll be honest with you. But for people that can't work out, back injuries, neck injuries, people that are older, we're looking to do this with a senior citizen trial. Pretty amazing stuff. And you can actually build muscle mass with a machine now. It sends electrical impulses into the machine that causes contractions, which is just blowing my mind. So I'm real excited about that, just letting you know what the future is at Health Plus Wellness Center is the name of our clinics. The future of Health Plus Wellness Center with testosterone supplementation. We already have the medical places and medical treatments in place. The PRP is just like, it's going to be the greatest thing in medicine as far as I'm concerned, to help regenerate and bring down inflammation. We're working with erectile dysfunction. That's going to be another thing we'll be adding to the treatment as well. So a lot of things we're covering to try to cover as much as we can in the anti-aging world to try to keep you as healthy as possible. It's called regenerative medicine, but keeping the body healthy and fighting aging. The results have just been phenomenal that I'm seeing. It's just crazy. So all this is available. Most of it's available already. It's going to be available soon. If not, it's not on the website quite yet, but it will be probably in the next week or so. So pretty neat stuff. And again, so if you want to make an appointment to come see us, stop suffering needlessly. If you have neck pain, back pain, shoulder pain, arthritis, knee degeneration, PRP is like blowing it out when it comes to knee arthritis, come see us. The biggest complaint I get is, why didn't I do this sooner? Why did I suffer for so long? So we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Chiropractic, nutrition, digestive issues, PRP, hormone therapies. And that works, by the way, the hormone therapy works well with erectile dysfunction too in many cases because testosterone gets lower. And putting together a whole protocol to try to get you the best we possibly can. And if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. I am on my knees begging you, please come see us immediately after a car accident, because every day that goes by, and sometimes it's years and decades, but every day that goes by, the problem gets a little worse and a little worse. If the car was damaged, you were damaged. 100% of the time in my career, I've never seen anyone in a car accident where the car was damaged where the occupants weren't. So I strongly advise you come see us. First visit is normally $375. We've reduced that to $149. That's exam, x-rays, consultation, first chiropractic adjustment, going over the x-rays on the next visit, and a complete nutrition protocol. And that's $149. Future care, and most of you are going to need future care, is covered by most insurances. We have cash plans available. Very, very affordable. Chiropractic is the most effective, least expensive treatment for back pain. And I can't imagine why, in any way, shape, or form, you wouldn't be getting chiropractic care as your portal of entry when it comes to health issues. Some, not all issues. You have a heart attack, go to the hospital, of course. Break a bone, go to your orthopedist. But in most health issues, let's start here, and then we can escalate the care. We can go to nutrition. We can go to PRP. We can go to pain management. We can go to hormone balancing. We can go to the machines that can help build the muscle mass for you. So there's a lot of different things that we can cover, and that's why our office, I feel, is a good place to start. So if you want to make an appointment, drjoe.com, drjoe.com. You'll see a picture of me. Right next to my picture, even with my belly, you'll see a link that says appointments. Almost every day, somebody sends me a question. I can't see where to make an appointment. It says appointment. It looks like a calendar. So click on that, pick the office you want to see, pick the time. We'll reach out to you. We'll confirm all that. And with insurances, again, we can verify your insurances for you, and we'll handle, we do all the billing for you, including Medicare, by the way. So stop suffering. I mean, 37 years. I've been banging my head against the wall for 37 years saying, why do people suffer so much when we have answers in most cases? Not all, but most. I don't understand it. And every day, Dr. Joe, I've been listening to you for 5 years, 10 years, 20 years. I should have been coming here sooner. Yeah, you should have. The sooner you get to us, the better. So with osteoporosis, we talked about that. Supplement-wise, I would take Super Greens and Essential Source as your base supplements, of course. Vitamin D3, we talked about that as well. Glutathione, I think, is really important to keep the liver healthy. I take that every day. I take omega-3 fatty acids to keep the inflammation in my body down. My brain needs those omega-3 fatty acids. I take adrenal support because the adrenal glands help produce energy. They produce hormones, and they work as anti-inflammatories. So I've created a personal protocol for nutrition. And when I get my bone mass done, when I get my blood work done, everything is just like amazing. It's like off the chart where it needs to be. If it didn't work, I wouldn't do it. If meatball sandwiches on Italian bread with provolone cheese was better for you than what I'm doing, I'd be doing that, trust me. I can do any treatment I want. I can take any supplement I want. I can eat any diet I want. I know that this is the best thing out there. And again, if there was something else better, I'd be doing it. That's why we introduced our medical department. That's why we're doing PRP with our patients. That's why we're doing sometimes nerve blocks to bring down the swelling so we can do better chiropractic adjustments. Maybe you've been to a chiropractor, you're just not getting the results. Maybe we need to escalate your care. I'm not here to take you away from your chiropractor, please, any doctor. I'm never here to steal a patient. But maybe we can do things to escalate the care to try to get you better. So that's our goal here. Our goal is to try to give you all the options that we can to get you well as quickly as possible. All the supplements are available on the website, drjoe.com. If you have questions, send them to me through the website. Search the website. We have over 1,500 hours of podcasts. Search for what you're looking for. If you come by our offices, Marietta, Duluth, Stockbridge, or West Cobb, you can pick up the supplements, and that'll save you the shipping. And we'd love to see you, too. We'd love to meet our patients and our listeners. So once again, folks, I'm Dr. Joe Esposito, the website drjoe.com. Thanks for tuning in. Follow us on Facebook and Instagram. Catch you next time.